In this video, we are going to complete the gastrointestinal system. Now, in the gastrointestinal system, we are going to do it in two parts. The first part, we are going to complete the first part is going to be the peptic ulcer and GRD. And in the second part, we are going to complete the antiemetics, then drugs used in diarrhea and constipation. Okay. So this is how we are going to complete the the GIT system. Now, let's understand what is peptic ulcer. So what is peptic ulcer? Peptic ulcer basically it's an imbalance between the defensive factors. So what are the defensive factors? Defensive factor hota hai mucus, bicarbonate and the blood flow. So an imbalance between the defensive factor and the aggressive factors. Now what are the aggressive factors? Aggressive factors are acid, pepsin, NSAIDs and H. pylori infection. Right? So an imbalance between these two will result in acidity and that will result in peptic ulcer disease and GRD. So let us understand it from the diagram. It is very important to understand the diagram first. So our hydrogen potassium ATPase pump होता है, ये हमारी parietal cell है, okay? This is our parietal cell and यहाँ पे एक pump है, that is hydrogen potassium ATPase. Now this pumps potassium inside and hydrogen outside. This is the gastric lumen, okay? And this is the blood vessel. ठीक है? तो ये lumen है और ये हमारी parietal cell है. तो अब यहाँ पे जो ये hydrogen potassium ATPase pump है, this hydrogen potassium ATPase pump, this is present in the parietal cell and it is present on the apical membrane of the parietal cell, right? Now, what are the various things which will stimulate the acid secretion and what are the various things, then how we introduce the medicines against them. So now there is something called as M3 acetylcholine receptor, right? This acetylcholine receptor increases cytosolic calcium and increases the acid secretion. So that is having a plus action, okay? Then we have histamine H2 receptor. So this also acts on this, it increases cyclic AMP and it also has a positive influence on the hydrogen potassium ATPase pump, okay? Then there are enzymes like CCK, gastrin. So they also increase the calcium and they also have a positive influence, okay? Then there is another thing which is called as PGE2. PGE2 matlab prostaglandins. Prostaglandins decrease cyclic AMP and they have a negative influence on the hydrogen potassium ATPase pump, matlab usko inhibit karte hain. Okay, so these are the various targets and the main target is this directly. So let's understand what are the drugs. Now the first drug I'll discuss is proton pump inhibitor. Okay, now proton pump inhibitors, they act from the luminal side. They act from the luminal side and they inhibit the hydrogen potassium ATPase pump. Okay. Then for prostaglandins, we have a drug which is called as misoprostol. This misoprostol is a prostaglandin analog and will increase the mucus, increase the bicarbonate and the blood flow and reduce the acid. Okay. Then anticholinergics. So anticholinergics we have which have a negative influence, that is pyranzapine, telanzapine. Okay. So these drugs, they inhibit this acetylcholine receptor, they are anticholinergics. Then we have antihistaminics. So antihistaminics again will inhibit the histamine receptor and in this we have drugs like cimetidine and ranitidine. Okay. So these are the various actions. तो क्या क्या है यहाँ पे? PPI, misoprostol, anticholinergics, antihistaminics. उसके बाद then there are some surface active agents. Some surface active agents होते हैं जो कि ulcer को they protect the ulcer bed. Okay. So we have some sulfur active agents, surface active, and we also have antacids. So antacids basically by chemical action they neutralize the acid. So these are various drugs which are acting in the treatment of gastric ulcer. Okay. So as I've seen, sorry, I wanted to clear one thing here. This is M1 receptor है यहाँ पे muscarinic M1. Okay. So let us summarize the drugs once again. M1 blockers होते हैं like pyranzapine and telanzapine. Then H2 blockers होते हैं like cimetidine and ranitidine. Then we have PGE2 analogs, that is misoprostol, and then we have PPIs in which we have omeprazole, esomeprazole, then pantoprazole, then lansoprazole, rabiprazole. So there are many drugs in this container. Okay. Now NSAID induced ulcer. You have heard about this, like aspirant causes ulceration. So long-term use of NSAIDs causes ulcer. So most specific drug against NSAID induced ulcer is misoprostol. Okay. But the drug of choice in NSAID induced ulcer is PPI. So don't forget this. It is many a times it is asked in the questions as MCQs also. So you should not get confused in them. The next category of drugs. Now let's start discussing the drugs one by one. So the first category of drugs that we are discussing is antacids. Okay. Now antacids are divided into non-systemic and they are divided into systemic. Okay, so non-systemic में आती हैं drugs magnesium hydroxide, magnesium trisilicate, aluminum hydroxide, then nagalrate and calcium carbonate. Okay, these are non-systemic. Systemic में आते हैं sodium bicarbonate, then sodium citrate. Okay, now the systemic ones, these drugs are not indicated for long-term use. Why? Because they release carbon dioxide first of all, then sodium chloride gets absorbed, the substance sodium chloride is formed, and then it can absorb, can cause it can increase the blood pressure if there is a patient of blood pressure. Then systemic and urinary alkalosis can happen, and they can also do a rebound hyperacidity. Okay, so antacids, systemic ones are not very commonly used. Now let's go to the non-systemic antacids. Now non-systemic antacids, they are slower but longer acting. Okay, they have no rebound acidity, they do not cause any rebound acidity. Then aluminum hydroxide is constipating. Okay, and magnesium hydroxide is diarrheogenic. So they are combined together because so that this side effect is relieved. Okay, so this magnesium and aluminum, they are combined because one causes constipation, one causes diarrhea, and in combination then that effect is nullified. Then the antacids, they also consist of simethicone. Now what is simethicone? It is actually an anti-foaming agent. Okay, and it is water repellent. It basically reduces the flatulence and also is used to prevent bed sores. This is a different action, so remember this. Okay, now antacids doge. So what are the side effects? Antacids, first of all, they will reduce the absorption of acidic drugs, right? Because they will inhibit because acidic drugs, they remain unionized in acidic medium and so they are absorbed. But if you reduce the acidity, then the pH will change and the acidic drug will not be absorbed, right? Then antacids, they also interfere with the action of PPIs and sucralfate because they need a less pH for action. Okay, so less pH is needed for action, and as a result these drugs, they do not act if you give an antacid also to the patient. Then antacids, they form complex with tetracycline, so tetracycline should not be given with the antacids. Then other actions, there's something called as milk alkali syndrome. Now what is milk alkali syndrome? It is basically characterized by hypercalcemia, renal insufficiency, and metabolic alkalosis. Okay, milk alkali syndrome is caused by excessive dose of sodium carbonate or calcium carbonate with calcium rich food. So if you give excessive dose of calcium carbonate or sodium carbonate with calcium rich food, it can result in milk alkali syndrome. So this is all about the antacids. So we have to know the classification, then about the different constipating and diarrhea and simethicone, then the side effects of antacids and milk alkali syndrome. The next category of drug that we are going to discuss is PPI or proton pump inhibitors. And what are the drugs which are there in proton pump inhibitors? Let's enumerate them. And there are many new drugs also in this. So जो पुरानी drugs थी omeprazole, then pantoprazole, omeprazole. Okay, then we have lansoprazole, then rabiprazole, then there is a drug called as elaprazole which is approved in Korea, and we have a drug called as tenetoprazole which is approved in Japan. Okay, now specific characteristic about these drugs. सबसे पहले, they are all prodrugs. Okay, second thing, they are hit and run drugs. मतलब they block the receptor and the action of blockade of receptor remains for some days. So these are called as hit and run drugs. Then they are irreversible inhibitors. Okay, their action is irreversible. Fourth point is they are given orally and the tablets are enteric coated so as to protect them from the acidity of the stomach, and they exert action systemically and not locally. So from the intestine, right? What is the receptor they are acting at? They are acting on hydrogen potassium ATPase receptor, causing irreversible inhibition. Okay. Now let us see more details. These drugs are weak bases, so they can be destroyed by acids. So that is why we give enteric coated tablets. Okay, now enteric coated tablets. So whenever you must have seen the medicines, they are usually sustained release. इस तरीके से लिखा होता है, ठीक है, sustained release, or it is written extended release. So what does that mean? Sustained release or extended release means these drugs are going to have a longer duration of action, and they are going to be released slowly in the intestine. Now enteric coated tablets are taken, they are absorbed in the intestine. Okay, now from there, once they are absorbed, then prodrug is released. Prodrug is released there, which is activated first by metabolism. Okay, and this active moiety, what is the active moiety in them? The active moiety in PPI, proton pump inhibitors, is known as sulfonamide, and this then goes to the apical membrane of parietal cells. Okay, and there it is trapped, and after getting trapped, it inhibits the receptor or the pump. Okay, so this is the mechanism of action. This is the important pharmacokinetics which you should know along with the proton pump inhibitors. Fine. Now let's move on to the drugs. सबसे पहले they are given orally, empty stomach, so that their absorption is complete. Okay, then pantoprazole, esomeprazole, lansoprazole, these can be given IV also. Okay, then they have a short half-life, but action lasts for more than 24 hours, so they are called as hit and run drugs. Okay, then next let's see, there is a drug called as tenetoprazole. Now tenetoprazole is a very long acting PPI, and it suppresses the nocturnal, and nocturnal secretion is also called as basal secretion. There is two types of secretion, one is basal and one is stimulated. Stimulated is in response to food or the thought about food, and nocturnal or basal is when there is no food, no stimulus, and still there's a basic level of secretion. So tenetoprazole is found to inhibit this basal secretion also. Then a very important point here I would like to add is that stress-induced gastric ulceration and gastric bleeding, it is found that IV infusion of H2 blockers is preferred over PPI. Okay, so please remember this point, that when there is a stress-induced gastric bleeding, then IV infusion of H2 blockers is preferred. Now if we see about the side effects, so PPIs don't have much side effect, but in rodents it was seen that they were carcinogenic, but similar kind of effect is not seen in the adults. Now all the drugs are substrates of cytochrome P, 2C19 and CYP3A4. Okay, except rabiprazole. So please remember this point also, that all these drugs are substrates of CYP2C19 and CYP3A4 except for rabiprazole. Then next we have a very important fundamental. There is a drug called as clopidogrel. Okay, we know this is used, this is an anticoagulant, and so it is used, antiplatelet agent hota hai. Now clopidogrel is a prodrug, and this is activated by CYP2C19. Okay, now why I am telling you here is because we have a relation with PPI. Omeprazole inhibits this CYP2C19, and it results in decreased activity of clopidogrel. Now what is so specific about this? Because if there is an inhibitor of the enzyme, then it should increase the concentration and increase the toxicity. But here, because clopidogrel, the question will be like, omeprazole results in decreased activity of clopidogrel. Why? So there you have to set your mind into thinking that omeprazole inhibits CYP2C19, and this CYP2C19 activates clopidogrel. So because the activation will not happen, the prodrug will not be converted into an active metabolite, so the activity of clopidogrel will reduce even if the enzyme is inhibited. Okay, so this is important, and that is why I have told you it here. Now rabiprazole, because it is not inhibited by any of these enzymes, so it has minimum interactions. Okay, now if you use these drugs for a long-term use of PPIs, so what will be the side effect? Long-term use of PPIs will result in reduced vitamin B12, okay, increased risk of fractures. Why? Because there is reduced absorption of calcium. Then increased risk of increased risk of infections. by Clostridium difficile and even bacterial gastroenteritis. Why this is so? Because it actually disturbs the gut flora. By reducing the acidity, it actually disturbs the gut flora, and that is why these are the long-term effects of PPIs. Subnormal vitamin B12 levels, increased risk of fractures, and increased risk of enteric infections, and also increased risk of pneumonia. Okay, so this is the long-term use of PPI. Now next we have another 2-3 points about this. Lansoprazole is the most active proton pump inhibitor. Then lansoprazole is also safest in pregnancy. Okay, rabiprazole is fastest acting proton pump inhibitor, and I have already told you that rabiprazole has minimum interactions. So these are some important points related to proton pump inhibitors. The next category of drugs that we do is H2 receptor antagonist. Okay, now let's see the H2 receptor antagonist. So the drugs H2 receptor antagonist, we have ranitidine, cimetidine, famotidine, then roxatidine, and there's a new drug which is lafutidine, and lafutidine is basically approved in Japan. Okay, now these drugs, as we all know, they competitively inhibit they are competitive inhibitors of H2 receptors in parietal cells. Okay, now these drugs are more effective in reducing the basal or the nocturnal acid secretion. Okay, now a very important part in these drugs, we should know about cimetidine. Cimetidine ke upar many questions come. Now cimetidine is not used. Why it is not used? First of all, it crosses blood-brain barrier, and so it results in mental state changes. Okay, then second, it causes impotence in males because it inhibits the binding of dihydrotestosterone to androgen receptors. So it has got an anti-androgenic action. Okay, so that is one major side effect. Then it is a potent inhibitor of cytochrome P enzymes. So it causes a lot of drug interactions. Then it has got least potency as an H2 blocker. काम सबसे कम करता है, ठीक है? फिर अगर आप if you give it by rapid IV, then it causes many CNS changes. So all these reasons have made cimetidine a drug which is not preferred or not used. Okay, so please remember all these side effects of cimetidine. Now let's see the other drugs. Famotidine is found to be most potent H2 receptor blocker. Now all H2 blockers inhibit the first pass metabolism of ethanol. Okay, except famotidine. Famotidine doesn't have any लेना देना with ethanol. Okay, आगे बढ़ते हैं इसी में. Laxatives is a non-competitive blocker. Remaining are competitive antagonist. This is a non-competitive blocker. Then there's a drug Nizatidine. Nizatidine also has anti-acetylcholinesterase activity, and so it can cause bradycardia because it will potentiate or increase, as it will increase acetylcholine. Okay, this is something important. Then Nizatidine has negligible first pass metabolism. Okay, next, lafutidine. Lafutidine enhances, it has got additional actions. Lafutidine enhances nitrous oxide, mucus, and mucosal blood flow, and so lafutidine can be used for other diseases also, but that is not done right now. Okay, the next category of drugs that we have is potassium acid blower. So in this, the drug which we have, it is a new drug. Please remember the name. The name is Vonoprazole. This is approved in Japan. And there's another drug, Rivaroxaban, which is approved in Korea. Okay, now these drugs, they are basically competitive blocker to potassium site of proton pump, and they do it as a reversible blockade, right? And they cause very fast acid suppression. Okay, so this is a very specific class, a new class of drugs, potassium acid blowers. I think it is blockers. Vonoprazole and Revaroxaban. So these drugs are competitive blockers to potassium site. And I don't understand, like a lot of drugs I've seen are approved in Japan and Korea. So do they eat very spicy food? That there is more of acidity in Japan, and that is why they're, inventing new drugs. Anyways, the next category of drugs that we have to discuss is anticholinergics. ओके, नाउ एंटीकोलिनर्जिक्स कितने तरीके के होते हैं? एंटीकोलिनर्जिक्स में एक दवाई आती थी पहले, प्रोपेनथेलिन एंड ऑक्सीफिनोनियम. Now these drugs, they had adverse effect of all the anticholinergic side effects like dry mouth, then blurred vision. ठीक है, 4 साइड इफेक्ट होते हैं, वो याद कर लो. ड्राई माउथ, ब्लर्ड विजन, यूरिनरी रिटेंशन एंड constipation. These are the 4 side effects of atropine, and these are even the symptoms of atropine poisoning, so remember them always. Then now we have newer drugs. Newer drugs में क्या नाम है हमारे पास? Pyrazapine and telanzapine. These drugs are selective M1 blockers. So they lot of side effects are reduced in these. Okay, so these are the anticholinergics, but see, they are not very successful or not very commonly used because we have better drugs. Then the next category of drugs that we have to study is prostaglandin analogs. Now prostaglandins, because they increase mucus, they increase bicarbonate, and they increase the mucosal blood flow, so they are more of protective agents. Now इसमें जो होता है एक PGI2, PGE1 and PGE2, they are more of ulcer protective, right? And why are they protective? They are protective because they increase the mucus, they increase the bicarbonate, they decrease the acid, and they also increase the blood flow to the mucosa. Okay, so these are the actions. So what is the drug which we have? The drug is misoprostol, which is a PGE1 analog, and this drug is found to be used in the most specific drug for NSAID induced ulcer. Okay, then we have other drugs also, that is enprostil and rioprostil. The side effects of these drugs is diarrhea and colicky pain. We know that prostaglandins, they cause pain, so the side effect of PG analogs is diarrhea, colicky pain, and these are the drugs which are used as PG analogs, right? Then let's come to ulcer protective agents. Now ulcer protective agents में हमारे पास 2 items हैं, and उनके नाम हैं sucralfate and colloidal bismuth subcitrate. Okay, now sucralfate and colloidal bismuth subcitrate. So these drugs, they, sucralfate की बात करते हैं अपन. sucralfate का क्या है कि at pH less than 4 it polymerizes and forms a resin, right? So this coats the ulcer bed and protects it, and thus helps in the healing part. A side effect of sucralfate is that it should not be first, it causes constipation, and another thing very important is that should not be used with antacids, because antacids will interfere in the action of sucralfate. Then it interferes with absorption of phenytoin, so minimum 2 hours gap to be maintained between sucralfate and any other drug. Okay, the next ulcer protective agent is colloidal bismuth subcitrate. Okay, this is also called as CBS. Now CBS का क्या है देखो, CBS basically again forms an acid resistant coating. CBS का एक और action है, very important action. It dislodges H. pylori from the surface, from the mucosa. So this is also, that is why CBS is also used in the H. pylori induced ulcers. Now adverse effect CBS के अगर अपन देखें तो it causes blackening of stools, blackening of tongue, and bismuth toxicity. And what are the toxicities of bismuth? It causes osteodystrophy and encephalopathy. So these are the 2 toxicities that are caused by bismuth subcitrate. So these have to be taken into care. Then we have drugs which are called as ulcer healing. Ulcer healing में the drug which we have is called as carbinoxolone. This is obtained from the roots of licorice plant, right? Now what does it cause? It causes epithelialization of ulcer without any effect on acid secretion. Okay, so carbinoxolone is basically a drug that causes epithelialization of the ulcer, does not have any effect on the acid secretion. Then but this carbinoxolone, इसके side effects क्या होते हैं? It can cause hypertension, it can cause hypokalemia, and it can cause sodium and water retention. Okay, then there are 2 new drugs, ribamapide and icabet. These drugs are cytoprotective agents, and they act by increasing the prostaglandin generation. So these are drugs which are again can be used in ulcers. That is ribamifide and icabet. Last in the ulcer, peptic ulcer, we have to study anti-H. pylori drugs. So anti-H. pylori drugs, basically diagnosed by urea breath test, and it causes peptic ulcer disease. Okay. Now a triple drug therapy is given, which consists of 1 PPI and 2 antimicrobial agents. Okay. Now antimicrobial agents which can be used are amoxicillin, metronidazole, and clarithromycin. So these are normally the antibiotics that are used. Sometimes in quadruple therapy we also use tetracycline. Okay. Now usually there is a combination which is very commonly used, which is called as CAP, and CAP consists of clarithromycin, amoxicillin, and proton pump inhibitor, which is lansoprazole. Okay. So this is the most commonly used triple drug therapy regimen which is used in H. pylori infection. Then after triple drug, if the disease is still not controlled, then in some cases we use quadruple drug therapy also. Another one more important point I would like to tell you is continue with PPI after 2 weeks if the ulcer is not healed. This is usually given for 2 weeks. Okay. Now quadruple drug therapy consists of colloidal bismuth subcitrate plus tetracycline plus amoxicillin plus omeprazole. Okay, so this is a quadruple drug therapy that is given. Now in this first line drugs that are used are PPI तो होता ही है, amoxicillin होता है, clarithromycin या metronidazole. Second line drugs PPI plus amox, clarithromycin or metro. Those who are allergic to penicillin G can use PPI plus clarithromycin plus metro. Okay. Then third line drugs we have PPI plus amox, CBS, and clarithromycin or metro or tetra. So these are the 3 categories of anti-H. pylori drugs which are used. With this we finish the peptic ulcer, and in the next lecture we will be studying about the antiemetics drugs used in laxatives, and that is laxatives drugs used in constipation and diarrhea.